Namaste everybody, and on behalf of Council for Ayurveda Research, I welcome you all for our 10th Journal Club meeting. And today's presenter, Dr. Vinay, he is a BDS, MDS, Public Health Dentistry Specialist, a well-known health researcher, biostatistician, epidemiologist, and public health dentist. So he is also expert in various meta-analysis studies, systematic reviews, and also working as head of research and statistics at the P-Value Research and Statistics Educational Firm. He is assistant professor and researcher at Sihanga Dental College and Hospital, Pune since 2015, and working as research faculty for Maharashtra University of Health Sciences, Nashik, and also with various biostatistics and epidemiological assignments. He is working with many researchers across the globe. He was also the first researcher who was working with tobacco cessation training program for level 1 and level 2 with more than 45 publications, more than 15 systematic reviews and meta-analysis, and with a guiding experience of 25 research projects. I welcome Dr. Vinay sir, because today's topic is very special in one aspect, that this is something about Ayurveda, fixed Ayurveda regime, and how we can compare that fixed Ayurveda regime with, as an add-on therapy with a established drug, and particularly in COVID scenario. So today's topic is also in terms of research design, it is very unique. And sir will be throwing some light about how we can critically analyze this article. And I must again say this disclaimer to everybody that here we are doing this critical appraisal of the article so that we can understand how to write the good article or publish the good material. Also, how to read it, how to decode the article in scientific way. So I would like to request Dr. Vinay sir to start his presentation, and those participants who have any queries or suggestions, or they want to discuss something about any other article with sir, they can put their queries in the chat box. So I welcome Dr. Vinay sir, and I would like you to address the meeting for today's journal club. Thank you so much, sir, for being here.
Thank you, Dr. Panita ma'am. Thank you very much for inviting me to be a part of Council for Ayurveda Research, taking a Journal Club meeting. And I have known Pranita ma'am since a while, and she has been very active in research activities and all those things and everything related to Ayurveda research or any other kind of a research. She's being a faculty of Maharashtra University of Health Science also. And we have connected together a lot. We have been doing a lot of work together, and she's doing an amazing job by conducting this journal club meeting, which is very important nowadays, because a lot of publications are coming up. People are putting up a lot of articles in different kind of a journal, and sometimes the journals are not up to the mark, and the hard work done by the researchers are going wrong. It's going bad. They're putting up it in the wrong journal. So it's very important for us to understand the journal which you are targeting, in the journal which you are going to put up your research is very important, because it's a hard work what you have done, and try and be away from these predatory journals, which are very common nowadays because of the want of publishing. Students and faculty members are just publishing in any kind of a journal. So you have to be very vigilant for it, and take care of, look at the journal, take care about it, think and keep looking in various databases, whether that particular journal is indexed in those, good databases like Scopus or Web of Science or PubMed index. All those things, you have to be very vigilant about it. Don't just put up in a journal, whatever journal comes to your way. So you have to be very vigilant. And having said that, we'll start with the journal club right now. So I hope everybody has the article with them, the article which we are going to discuss. Now, remember one thing, the article, what is written, we are not here to criticize the article. It is a hard work done by a group of people. They have done a lot of hard work for making such a, doing such a research and then putting up in a journal. So it's not that what we criticize, but we are going to critically evaluate or critically appraise the article, all good things in the article or all other things which are not up to the mark, which are deficient, which are the limitations, the strength of an article, how beautifully they write, or what are things, what are mistakes they have done in, or what are things they have missed out in writing an article. That is what we are going to discuss today. Also, having said that, different study designs have different guidelines to report. So for an example, if you are writing an observational study, if you have done an observational study and you want to report, reporting means you are putting up in a journal. You have written an article, you are putting up in a journal. The particular article should follow certain guidelines. For observational study, it has to be a stroke guideline. Fair enough. Similarly, for randomized controlled trials, generally we should follow consort guidelines. Okay, so these are the few guidelines. There are various other guidelines for systematic review meta-analysis. There is PRISMA guideline, there is a CARE guideline, there is a CHEERS guideline, different types of guidelines for different study designs. But always try, whenever you write an article, follow those guidelines, and then your article becomes very up to the mark, very publishable, so that people will start, when they read, they will like your article because you have covered most of the part. Okay, coming to the journal club, we are going to have a critical evaluation of the particular article which is there. Before that, I'd like to put up a disclaimer that this presentation is for academic purpose only, to understand methods for critically appraising a scientific manuscript. It by no means intends to harm or criticize the investigators or any other personnel connected to the manuscript or critical study. The views expressed herewith are with sole purpose to be academic, and the presenter declares no conflict of interest. This is not my own article. I'm just going to critically evaluate, and we are going to understand how to assess an article. What are the parts of the article? And whenever you write a manuscript, what are things you should follow? That is what we are going to discuss in a journal club. So good evening, everyone. And who wants a coffee? Everybody wants a coffee, right? This is a time. Good evening. Coffee is very important for us. So if you have a coffee with you, very good. It's an online thing. Have a coffee and then you can listen to the topic. Fair enough. Before I start, what is the topic about the journal club? What is a journal club basically? It's like a group of individuals who meet regularly to critically evaluate recent articles in scientific literature. That is a journal club. It's like we go for clubbing, a group of people going for a disc or a restaurant or somewhere we go clubbing. So that is journal club is something where we all together, we sit together over a coffee, over a tea, or over a breakfast, and we discuss something about a scientific literature. We critically evaluate that particular article, and that is called a journal club. It is basically organized around a defined subject. So we have a topic with us. We have a fixed Ayurveda regime, which we are going to discuss. We have a topic which we are going to talk about, how this study has been conducted, what is the methodology has been done, how beautifully they have written the introduction, the methodology part, how beautifully they have presented the results, what things they have discussed in the discussion area, how they have concluded, how they have written the references, and small other parts, very important parts like acknowledgement, conflict of interest, funding, all those parts. Those things has to be covered whenever you write an article or whenever you critically evaluate an article. So this is a journal club. A little history about journal club. It started with Sir James Paget, and the hospital was St. Bartholomew's Hospital. So in this, over the coffee, over the breakfast, they used to discuss among their students about a particular study, about a particular research. So it started then by Sir James Paget, and followed with Sir Williams Osler by McGill University, Montreal, in 1850s. That is the time when they did it. And then came Harrison. Everybody knows about Harrison. He wrote a book on internal medicine. So he followed the journal club tradition in Alabama School of Medicine. So this is how the journal club started. This is a little history about journal club. And today in 2021, we are conducting a journal club. So we are a part of history now. So people will count us later. Yeah, fair enough. Now, in science, one thing you should remember, in science, the credit goes to a man who convinces the world. not to the man to whom the idea first occurs. This was given by Sir William Osler. If you have an idea, if you have something in your mind, if you have done a research, it's not that you just keep it to yourself. You have to convince the world with your results, with your study. So then you will get the credit for it. For that, you have to write a manuscript. You have to write an article and publish so the world knows that this work is done by you. So this is important for science. Okay. Now, coming to the topic. Now, everybody has a topic, and the topic is, the title of the study is Prospective, Randomized, Open Label, Blinded End Point, Two-Arm Comparative Clinical Study to evaluate the efficacy and safety of a fixed Ayurvedic regimen, FAR, as add-on to conventional treatment in a management of mild and moderate COVID-19 patients. Fair enough. The title is very specific. From the title itself, you will understand what is going on in this study, what they have planned for. Fair enough. So each and every word in this title is very important. So whenever you frame a study, whenever you are doing a research, your title is very important. How beautifully you write the title. Okay. Now, in this journal club, we will be talking about the journal. So whenever you critically evaluate, read the article right from top to bottom. Each and every word in this article, in this study, which is given to you in this literature, is very, very important. It is about the journal, it is about the article, which is very important. The authors are important, title, abstract, introduction, methods, results, discussion, and references. Each and every point is important because they have a limitation. Whenever you write an article, there is a limitation. You have to write an article in somewhere around 3,500 to 4,000 words. So each word counts. It's very easy to write a book, but to write an article, to write a scientific paper, it's very difficult because you cannot write anything or everything. You have to be very precise and very specific about your study design or the complete study. So you have to cut short a lot of things. You have to add few things and make a proper article out of it, proper manuscript out of it. So each and every word given in an article is very, very important. Try and understand this. So we will be covering the topic in following contents. These are the contents of the topic. Fair enough? Okay. Let's talk about the journal. Whenever you critically evaluate an article, it is very mandatory to start with a journal. What journal this article is published in. So the journal is Journal of Pharmacy and Bioallied Sciences. It is a quarterly multidisciplinary open access biomedical journal. It is an international medium of interaction between scientists, academicians, and industrial personnel. It is now an official publication of OPUBS, or Organization of Pharmaceutical Unity with Bioallied Sciences. It publishes innovative papers, reviews, mini reviews, rapid communication, and notes dealing with all branches of pharmaceutical sciences, medicinal, analytical chemistry, biotechnology, and bioallied sciences. Started in 2009. Editor-in-chief is Roop K. Khad. Published in Walter Luer Medno Publication House. An impact factor of 2020 was 1.48. Print version ISSN number is given, and currently it has 13 volumes and 5 issues. A very important thing, the journal is indexed in DOAJ, Emerging Sources Citation Index, PubMed Central, Chicago Journal Ranking, Scopus, and Web of Science. So these are the places where these journals are indexed. So indexing is nothing. These are the database. This database recognizes a particular journal based on the quality, the impact factor, the quality of the editors, or the quality of the reviewers, the periodic of the journal, since how long the journal has been there in the literature, all those things. On the basis of that, they are indexed. So these are the various databases where this particular journal is indexed. So remember, whenever you critically evaluate article, start with the journal, what journal it is published in. Coming to the article, this article is an original online article. Nowadays, most of the journals are online. There are very few journals who still have, they provide you physical copies or hard copies with it. The article was received to the journal on 25th March, revised on 25th April 2021, accepted on 14th April and published on 26th May. The DOI number of the journal is being given, the volume, the journal is 13, of the article is 13, the issue is 2, and institutional attachment of all authors have been given in page number 1, and even the citation information. How to cite this article? If you are taking a reference of this article for your study or for your research, you are supposed to cite articles. They have also mentioned how to cite this article. You can see in a box at the end of the first page, they have written how to cite the article. So there are various authors in this study, right from the from the top. There is the author is Sashibhushan Vedula, Ruchi Srivastava, Sanjay Tamoli, Narendra Munde, D.N. Wag, Sanjay Batra, Manoj Patil, Hiren Babura Pawar, and Rajiva K. Rai. And these authors, the institutional attachment of these authors has been given. It is placed there. And the corresponding author's mail ID and portal address is also given in page number 1 at the bottom. So that is also you have to critically evaluate. Okay. So the first author is Arun Gupta. Now we will talk about the authors. Whenever you do a critical evaluation, you have to find out who the authors are, what are their credentials. Okay. So these are various authors. Their credentials are mentioned in here. First, second, third, fourth author, fifth, sixth, seventh, eighth, ninth, and 10th authors. There are 10 authors whose credentials are mentioned in this slide. You have to find out. You have to do a Google search or go to the PubMed or various profile, and you try and find out the credentials of these authors. All information about the authors will not be given in the article. So it is very important you to find out the credential, how good the authors are, or what are their publication earlier, or what they are doing right now. All this information should be there because this is their work, this is their hard work, and the weightage of an article is on the researchers. So it's very important for us to identify or find out the credentials of each and every author. Now, we have talked about the journal, we have talked about the article, and we have talked about the author. Coming to the title, this is very important right from title. The title, as I told you, it's a prospective randomized open label blinded endpoint 2-arm comparative clinical study to evaluate the efficacy and safety of a fixed Ayurvedic regimen FAR as add-on to conventional treatment in a management of mild and moderate COVID-19 patients. So now we are going to critically evaluate the title. The title contains 37 words, indicates topic and focus of the study. It indicates the research question. It is meaningful. It reflects the aim of the study. And it gives idea about the study population and study design. And it includes important variables which are intended to measure. So this is how critically you should evaluate the title itself. Okay. So these are the points on which you can critically evaluate how good the title, or what are deficient in the title, what are the limitations of the title. So the title also has some limitations. It is too long. So it depends on the journal. Journal will specify the number of words the title should have. Ideally, we should not keep a very long title, because then the interest of the reviewers or the people who study your article, it decreases a little bit. And it should not be too specific. Don't be very specific about the study, mostly about the study design. Okay, let people read the study and then find out what is the study design. So that is how you should critically evaluate the title of the study. I personally thought of giving an alternate title. So the alternate title will be efficacy and safety of fixed Ayurvedic regimen as an add-on to conventional treatment in management of mild to moderate COVID-19 infection and parallel arm randomized control trial. This is my personal opinion about the title. You can have your own personal opinion. You can give an alternate title when you are critically evaluating. Okay. Now remember one thing, try not to put abbreviations or short forms in the title itself. See now COVID-19 infection you can use because it's generalized term now. It is very common. Everybody knows about it. It is used very commonly and very frequently and everybody knows about it. But don't use the word FAR. You should use the word fixed Ayurvedic regimen. Okay, so try not to keep short forms or abbreviations in the title. Try to keep the title as short as possible. And the most important thing, whenever you do a title, you should follow the PCOS guideline, at least in randomized controlled trial. So P here, the patient with mild and moderate COVID-19 infection. Intervention, I is intervention. It is fixed Ayurvedic regimen with conventional treatment. And comparator is a conventional treatment. Outcome, they have mentioned about outcome is efficacy and safety. They have a lot of outcome, which I'll tell you in aim and objective. But they have specified it as efficacy and safety. And the study design is parallel arm randomized control trial. So I can make it very short, at least shorter than the original one. And it should follow the PCOS, which they have also done. They have also followed the PCOS guideline for writing an article, title. These are the backgrounds. They have started with the abstract. In the abstract, they have mentioned the abstract in background, objective, methodology, results. So small things they have mentioned in the abstract. Generally, an abstract is from 250 to 350 words. Some journal, they tell you write the keywords. So they have also mentioned the keywords. And the most important thing, the study is registered in CTRI, Clinical Trial Registry of India. And it is very important you mention the CTRI number in the abstract itself. Okay. The format of the abstracts might change. In some of the journal, they tell you to write like introduction, methodology, results, and discussion. But in this, they have mentioned about background, objective, methodology, and results. So it depends. It depends on the journal to journal, how they want your thing to be there. They have also mentioned the conclusion. They have written the conclusion in one straight line that FAR could be an effective and safe add-on Ayurvedic regimen to standard of care in the management of mild and moderate COVID-19 patients. So this is how you should critically evaluate the abstract. So the abstract is structured. You know what is structured? Structured means when you have given the headings for each and every part of the abstract, like background, objective, methodology, results, conclusion, keywords. So when you don't give the heading, you just write, right from top to bottom, 250 words or 350 words, then that is an unstructured abstract. So in this, they have given a structured abstract. The abstract is informative, it is very comprehensive, and there are 365 words in an abstract. It gives the gist of the whole text. Whatever study, what they have done, whatever manuscript they have written, the abstract gives the whole gist, whole information about, small information about everything which is given in the whole text. Okay. And it's very important, check the abstract and check the article also, the body of the article. Whether the information given in the abstract and the main article, main manuscript, it resembles or not. So it matches, it facilitates reader in his selection of pertinent studies and the keywords. They have given 6 keywords: Chyawanprash, COVID-19, fixed Ayurvedic regimen, Giloy, Kalmeg, and Tulsi. And they have arranged the keywords alphabetically. But these keywords are not mesh terms. Okay, COVID-19 and fixed Ayurvedic regimen are the word present in the title also. So this is how you critically evaluate. Now, why keywords are important? Because whenever somebody searches for your article, they will first write the keywords what is given in your title. If they are looking for some study, if they write fixed Ayurvedic regimen, so in the Google or in the internet or in the PubMed, automatically your article will reflect. So the keywords, try to use keywords which are not present in the title. Then your chances of your article reflecting increases, because you're not using the words which are given in the title. You're using some extra words, some other words which is not in the title but in the manuscript. Use those words as your keywords. So then your chances of reflection of your article in the literature increases, because you have more keywords now. So that is why keywords are very important. Coming to introduction, they have written the introduction. They have given the topic about the COVID-19. How is it a global pandemic now? What is the standard of care available right now? So according to them, there is no standard care of available for COVID-19, and they also tell how Ayush concept and intervention is important right now, because this is the opportunity time for Ayush and concept and intervention to develop better arsenal to prevent and treat the disease. So current study, they have told what the current study is designed to. They have a FAR, fixed Ayurvedic regimen, in which they have Giloy ki Ghanwati, Kalmeg tablets, Tulsi tablets, and Chavanprash. They are going to give us add-on to the conventional treatment. The conventional treatment here is antibiotic and all other regimen which is already being used for COVID-19 infection. And at the end, they have mentioned the aim of the study. So in the introduction, they have to give a little background about why you want to do the study, what is the need of the study, and what are you planning to do in the study. So the critically evaluating the introduction, it is meaningful and concise. It is built on existing literature. It is logically presented. It is a much discussed recently approach. So this is a topic which is much discussed recently, right? So that is approach which they have taken. The citations are relevant and pertinent to the study reported. These citations are followed with correct references in the list of references. So whatever references they have given in introduction, whether these references, citations are there in the references list also, you have to check that. Okay. And it has presented the need for the study. It is presented in the first para of introduction, and explicitly it should mention the aim. Some articles do not mention the aim explicitly. Fair enough. But in this study, they have mentioned the aim explicitly, which is to evaluate the efficacy and safety Ayush interventions as add-on to conventional treatment as SOC, that is standard of care in COVID-19 patients. So if you have any doubt up till now, you can ask me right away. I'm very much willing to answer your doubts. Or you can put up in the chat box and then let me know. Now, when you are critically evaluating an article, look for the research question. So the research question for them is there any effect of fixed Ayurvedic regimen using Ayush intervention as an add-on to conventional treatment in management of mild to moderate COVID-19 infection? So our research question should always have a question mark. So it is presented in the research question, the question mark is presented. Coming to the null hypothesis, the null hypothesis of this study would be there is no effect of fixed Ayurvedic regimen using Ayush intervention as an add-on to conventional treatment in management of mild to moderate COVID-19 infection. An alternate hypothesis is there is an effect of fixed Ayurvedic regimen using Ayush intervention as an add-on to conventional treatment in management of mild to moderate COVID-19 infection. So you know the difference. The null hypothesis should have no effect and alternate has an effect. There is an effect. Okay, fair enough. Coming to the aim and objective. The aim of this study is mean time required in days for clinical recovery. So they want to compare the mean time required for clinical recovery from COVID-19 from the day of first noting symptoms to the day of clinical recovery and from day of randomization to the day of clinical recovery. So this is their mean aim. This is the main aim, the mean time. Okay. Objectives, under objectives, they have a lot of different objectives. They want to compare the mean time required for testing negative for SARS-CoV-2 from the day of randomization and from the day of first notice symptoms, assessment of clinical recovery, post-clinical recovery and Ayurvedic clinical assessment, number of days of hospitalization, change in disease progression and requirement of oxygen or ICU admission or ventilator support or rescue medication, change in clinical status on WHO ordinal scale and health status on WHO quality of life, global assessment of overall change, percent mortality in the groups, and assessment of safety on the basis of adverse effect or serious adverse event and laboratory safety parameters. So these are the main aim and objectives of this study. Okay. So they have clearly specified the aim and objective of this study. So in the methodology. Now coming to the ethical conduct of the study, we'll start with the methodology. Basically, all these parts come under methodology. So they have taken ethical clearance. They have a CTI number. They have taken e-consent from the participants. They have also mentioned the study design. It is a prospective randomized open label blinded endpoint 2-arm comparative clinical study. The blinding of an independent investigator has been done. And all the requirements of standard of safety, quality and confidentiality of the patient data were followed for data collection. Patient enrolled from when to when has been mentioned in the article, in the manuscript which they have published. Okay. Then in the methodology, they have also mentioned about the study population, what type of patient they are taking, what type of patient they are excluding. Everything has been mentioned in the study population section. Okay. So this from COVID care center or dedicated COVID hospital, which comprised of male and female, age 18 to 60 years, laboratory confirmed PCR, RT-PCR, rapid antigen or any other test as per the current guideline, mild to moderate infection of not more than 3 days as per the Ministry of Health and Family Welfare's Government of India guideline. So they have selected they have selected participants or the patients based on the guideline given by the Government of India. And then they have excluded a lot of patients, different type of patients. They have excluded patients who have a severe COVID-19 infection. The respiratory distress is at room's ambience is more than 30 breaths per minute. Oxygen saturation is less than 93%. All these things, all this type of patients, they have excluded from the study. They have not included them. Patient with swallowing oral medication difficulty or chronic, severe, unstable, uncontrolled medical conditions like diabetes, hypertension, cardiac, liver, kidney, lung disorder, all these type of patients, they have excluded from the study. And they have mentioned it clearly in the article, in the manuscript. Fair enough. So this is how whenever you do a randomized control trial, what type of patients you are including, what types of patients you are excluding, you have to clearly mention in this methodological area where you are talking about the study population. And they have also mentioned the sample size. They have told 30 samples per 30 patients per group. This is very important. And how did you calculate? How did they calculate with the statistical formula? That also they have mentioned with 5% level of significance, that is 95% confidence interval. And the power of the study was kept at 80% on calculating sample size. So this is how they calculated sample size. They have mentioned 30 each in the two groups. So they have total number of 60 sample size. Now, in the methodological section, they have also mentioned about the study, intervention, and treatment. This is very important because they have to mention what kind of interventions they have done. They have to be very specific about it, what intervention they are doing. So in this study, patient in the FAR group, that is fixed Ayurvedic regimen group, they have prescribed Giloy ki Ghan Vati, Tulsi tablets, Kalmeg tablets, that is 1 tablet each, 2 times a day, and 1 teaspoonful, approximately 10 to 12 grams of Chawanprash twice daily as add-on to standard of care prescribed by concerned health authorities for 28 days. So this is, they have clearly mentioned. And patient in SOC group, that is a control group, that is a standard of care group, they served as a control receiving conventional treatment which comprises of antibiotics, anti-allergics, antipyretics, or multivitamins. That is a standard of care basically which was given to COVID-19 patients. So they have compared their FAR group with the standard of care group. In FAR group, it is an add-on to standard of care. So there are 2 treatments given in that intervention group and 1 treatment modality, which is a standard of care treatment given in the control group. Below that, they have mentioned the primary outcomes. I have already discussed about the primary outcomes: mean time required for clinical recovery, proportion of patients showing clinical recovery. That is a primary outcome. Secondary outcome is mean day required for testing negative, assessment of clinical recovery, post-clinical recovery, number of days of hospitalization, change in disease progression and requirement of oxygen, change in clinical status by WHO ordinal scale and health status on WHO quality of life, global assessment of overall change, person mortality, and assessment of safety. Now coming to the main methodology, they are talking about WHO ordinal scale first, how they have done the clinical status. They have taken patients' laboratory investigation like fasting, blood sugar, liver function, ECG, HIV status, and all those things. For all fertile female patients, they have done a urine pregnancy test as well. Okay. Patient Ayurvedic clinical assessment was done and their physical constituent, that is Ayurvedic dosha prakriti, and quality of life was assessed. Hospital stay, patient's physical and systemic examination, vitals and oxygen saturation level were routinely checked to see whether they are getting any adverse effect or severe adverse effect or not. ICU admissions, ventilator support, clinical recovery from COVID-19 symptoms, everything they are doing, whatever they are done, they are mentioned in the methodology. Mean day required for clinical recovery from the day of randomization and from day of first notice symptoms was recorded. Number of days of hospital stay was also recorded. Physical systemic examination, clinical assessment was done, and quality of life was assessed using WHO quality of life brief instrument. So all whatever methodology they have done, they have clearly specified in the methodological section. Each and every process what they have done for their participants, for their groups, they have explicitly mentioned that they have done this, they have not done this, this is what they want. For adverse event, what they have done, for severe adverse event, what they have done, for lab parameters, for safety assessment, what all things they have done, they have mentioned in this methodological section. Moreover, they have done a flow diagram also. This is very important. Whenever you're doing a randomized control trial or a clinical trial, draw a flow diagram. Make a habit of drawing a flow diagram. So it will clearly say what was the total sample patients screened, how many patients were excluded, how many were randomized, how many were kept in each group, and finally, how many were analyzed. So this is what they have done. They have given in a flow diagram. And whenever there is a dropout or withdrawal or attrition of the participants, if participants do not come or they move away, or some participants might die also, or they have left the place, or some people they don't show interest. All those things you have to mention. How many people have dropped down? How many have given a consent of withdrawing? Or sometimes as a principal investigator, you will withdraw the patient. So all those things you have to give in this flow chart. How many people started, how many you started with, and at the end, how many you analyzed. Coming to the critical evaluation of methodology, it's logical, clear, and meaningful. It is appropriate design for the aim and objective set by the study. Author have mentioned the study design. They have mentioned the study setting. It is done in different areas of Maharashtra. They have defined the study population also. They have clearly defined the inclusion and exclusion criteria, and the subjects were studied in a real life circumstances. So this is a clinical kind of a study where they have done it in a real life circumstances. This is an applied research. Whenever you do a real life study, that becomes an applied research. So this is what they have done. So this was the critical evaluation till methodology. Coming to the results, the observation and results. So in this article, they have clearly mentioned how many they have screened, how many recruited, and how many participants were randomized for each group. They have shown the study flow in figure 1. And check how beautifully they have written the article, the result section of this article. First, they have mentioned about the demographic status or detail. What was the age of the participant in both the groups? How many were male? How many were female? What was the BMI index? All those things. What is the weight of the participants? Everything they have mentioned in this demographic detail. And then they came for the assessment of Prakriti and Ayurvedic clinical parameters like Prakriti-White's analysis. And in this, they have mentioned clearly about each and every Prakriti, what they have done. Like Vata Pitta Prakriti, they have checked. Pitta Kapha Prakriti, they have done. Agni and Kosta, Dosha, Rogi Bala, Dushya, etc. Everything they have checked. Vishamagni, Mandagni, Tishnagni, Kosta, Madhyam, Rogi Bala, Madhyam Bala, everything. Vata, Vata Pitta, Vata Kapha, everything they have checked in this. They have done the assessment for us. You can look at the diagram, you can look at the table, you will understand. And they have compared between the groups, between FAR and SOC. So they have the result they have mentioned in here, everything they have shown. So they say the SOC group showed a predominance of Pitta Kapha Prakriti. Whereas Ayurvedic clinical assessment done at baseline basis, Agni and Kosta, Dosha, Rogi Bala, Dusha, etc. showed a predominance of Vishavagni in FAR group and Mandagni in SOC group. So everything, all the results, whatever they have got, they have mentioned in the observation and results. Then they came to the primary outcome, comparative assessment of mean time days required for clinical recovery. This is the part where they have mentioned. So this, according to them, what they say is the average number of days required for clinical recovery from the day of onset of symptoms, that is first day of appearance of symptoms, and from the day of randomization in a FAR and SOC group was 10.77 plus minus standard deviation of 3.24 and 16.30 plus minus 5093. And 8.40 plus minus 3.10 and 13.73 plus minus 5.66 respectively. The recovery in FAR group was assessed to be 51.34% faster from the day of onset of symptoms and 63.45% faster from day of randomization. And this result was statistically significant, and they have mentioned the p-value also. This is how when you write a result, you have to write it clearly. What was the mean, what was the standard deviation, and what was the percentage, and whether the p-value was significant or not. Mention the p-value, the value of the p-value, that is p less than 0.001. Coming to comparative proportion of patients showing clinical recovery, higher number of patients taking FAR showed clinical recovery within 1 and 2 weeks from the day of randomization. Whereas it took only 9.09% and 69.69% in control group showed recovery in 1 and 2 weeks. So this is how they have given the results. They have compared between FAR and SOC. Again, they are saying the p-value is highly significant, p less than 0.05. The p-value is significant, p less than 0.05. Coming to the secondary outcome, they have clearly mentioned about the secondary outcome, mean time days required for testing negative. In this also, they have mentioned the mean values, the standard of deviation, comparative evaluation of duration of fever and other clinical symptoms. Here also they have mentioned the p-value. They have mentioned the results in table 10. So you have to write in the bracket, whichever table your result is in, you have to write that in a bracket after the theoretical result. Whatever you write in the theory, you have to mention in the bracket in what table or the figure it is presented. Then WHO ordinal scale, they have assessed between FAR and SOC group. That also they have mentioned. Comparative assessment of disease progression and requirement of oxygen also mentioned. No mortality in the study is what they say. Number of days of hospitalization in the two groups also mentioned. However, there was no significant difference. Remember, even though your sum of results or all the results are not significant also, doesn't mean that you should not put up. You should put whatever results you are getting, whether it is statistically significant or not. Then coming to the assessment of post-clinical recovery, the results are in percentage, and here also they say it is there was no statistical difference. That's fair enough. Whatever results they have got, they have mentioned. Then requirement of rescue medication. If there was a requirement for rescue medication, they have mentioned in which patient what was given, how many patients required antibiotics they have given, how many requires anti-allergic, how many requires multivitamin or calcium supplements. Everything they have mentioned in the results section. Results are very important part of your manuscript because this determines the quality of your study. However, methodology is also very, very important. The way you conduct your study is very important. You have to show people how you have conducted the study, and you have to inform whatever results you have got. So result section, you have to be very careful in writing a result section, whatever you got in your results. Then again, the quality of result also they have mentioned. Overall efficacy and safety has been mentioned. Assessment of safety also, everything, every single thing they have mentioned. There were total number of 8 adverse effect, 4 in each group. What was the adverse effect? Everything they have mentioned in this part of the results. Okay, so these are the results. Coming to the tables. So these are the various tables which they have mentioned. There are a total number of 12 tables in this study, out of which 2 tables are for introduction part or the methodological part, and 10 tables are for result section. So you can interpret the table. It's very simple what they have given. This is how you should write. The table should be very, very simple. And in FAR group, you can see the predominant is Vata Kapha 19, that is 54.28% in comparison to SOC group, 16, only 48.48%. And everything, all these things they have mentioned, different things. The day of clinical recovery assessment they have compared. They have also mentioned the p-value here. The p-value was significant. Everything mentioned in the table as well as in the text. And always compare the results what is given in the table and whether that result matches with what is given in the text. So this is very important for you to compare. So these are the last 3 tables in which clinical recovery, rescue medication, and WHO quality of life scale, brief scale they have mentioned. Wherever they have got the p-value significant, they have also addressed the significant as putting it as an asterisk. They have written it below. Somewhere they have given 2 asterisks. If they wanted to compare between the groups, they have mentioned, they symbolized as 2 asterisks. And whatever short form they have used in this table, the full form of that particular short form also have been mentioned in below the table. And these are the graphs, what they have mentioned. They have also given a table and graphs and in the text format. Let's come to the critical evaluation. The results are presented in logical and comprehensible manner, presented in table, text, and figure. The tables and figures are numbered properly and titled properly. The table shows descriptive as well as inferential data. Wherever required, they have given the notes below the table and figures. There are 12 tables and 5 figures. The tables are complex type and alignment and information are done properly. It's not a simple table, it's a complex table. Figure 1 is a flow diagram and others a simple bar diagram. The data are given in text, tables, and figure match with each other. And the results, the most important, the results are based on the aim and objectives of the study. This is how you should critically evaluate the results. Am I clear? If you have any doubt, you can ask me right away. You can put it up in the chat box also. Coming to the discussion. Now, whatever result they have got, they need to discuss in the discussion section. So they have to give a backup of every result, why it has happened. What is the reason for this? What is the role? Everything they have to mention in the discussion area. And whenever you write a discussion, try and compare your study with the other similar studies in your line, in the same line. And discussion, you should also mention the strength and the limitations of your study. That is how you write. Writing a discussion is an art. You should be very specific in what you are writing. Most of the people, they read the discussion more because whatever results they got, how clearly you have mentioned in the discussion, what backup you have given, what reasons you have put up, what reasons you have got for your study, or the results, whatever you have got, what is the reason behind them. So that part has to be written in the discussion. So in this, they have mentioned about the COVID-19, how it started, what is fixed Ayurvedic regimen. They have mentioned why it is efficient than the standard of care treatment. Also, they have mentioned in your result, what all highlights which you have got in FAR group or the SOC group, they have mentioned in the discussion. Why that has happened also been mentioned in the discussion. And they are giving a perspective also, what further has to be done, what other study designs has to be done. And they are also mentioned the strength and limitations of the study. What is the strength of the study, where it has the limitation, all those things they are mentioned. Okay, they say you are supposed to do biomarkers also. You should check the effect of, evaluate the effect of on biomarkers and cytokinins. So this is what perspective they are giving. Okay, next, they should do a study, on biomarkers regarding comparing these two different modalities or treatment modalities. Then they are talking about the Giloy, Tulsi, and Kalmeg. Why it is, what health benefits they have in Ayurveda. How does it act It's an antiviral, it's an anti-inflammatory, it's immunomodulator, anti-allergic, antipyretic, antioxidant. And what is the advantage of Chyawanprash? All these things you have to mention whenever you are doing a study. You have to mention, discuss about your treatment modality, your medication. You are supposed to mention that in your discussion part of your research, of your manuscript. Okay. And then they have given a paragraph or 2 paragraphs on conclusion. They have concluded with it that FAR, that is fixed and Ayurvedic regimen, to be an effective and safe Ayurvedic regimen as add-on to conventional treatment or SOC in the management of mild and moderate COVID-19 patient. The study outcome establishes the role of Ayush intervention as add-on to conventional treatment in management of newer diseases such as COVID-19 infection. So they claim that the Ayurvedic or Ayush treatment or intervention is very essential for the treatment of COVID-19 infection. This is what the outcome of their study is. This is how they conclude their study. For that, they have a backup. They have a results backup. Whatever results they have got, it shows that fixed Ayurvedic regimen is far better than the standard of care treatment. Together with standard of care treatment, you should also follow with the fixed Ayurvedic regimen, which will help people to recover from COVID-19 infection very quickly and very efficiently. So that was, and it is very safe too. So their aim was to efficacy and safety, right? To evaluate the efficacy and safety. So this is what they got. It is safe as well as it is efficient. So the critical evaluation of the discussion, it is meaningful. It does highlight important findings of the study. There is enough explanation of all scientific findings. The authors have compared their finding with other studies. And the comparison is logical and reasoned properly. They have mentioned the limitations of the study. And this study opens new vista for further research. Like it should be done on the larger sample size, and it should also be done with the laboratory parameters like inflammatory biomarkers and cytokinins for better validation of the study. So this is how you critically evaluate the discussion. Coming to the last part, almost the last part, that is acknowledgement, financial support, and conflict of interest. You should always acknowledge all those who were involved in making your research, in doing research with you. Be it anybody, right from top to bottom, everybody's name you should acknowledgement. This is a good practice. Try to acknowledgement whoever are involved in their study. Okay, so in this study, who all were involved, they have acknowledged them. They have thanked them. And they've also mentioned that there was a funding done. There was a financial support given from Dabur India Limited. And conflict of interest, they have specified that 4 of their authors are employees of Dabur India Limited. You have to clearly state all those who are employed of Dabur, of that particular drug, the drug used in your study or the regime used in your study, that they do not have any conflict of interest. It means the results can be anything. They do not have any look out for the results. They are not influencing the results. So that is a conflict of interest they have declared in their article, in their manuscript itself. So these are the references, what they have done. They have a total number of 46 references. Use as many as references as you can. Don't make it very big also, but these are the quite good number of 30, 40, 50 references you should always use for a better article writing. And the references, they have 2 self-citations. They have cited themselves, their own previous article they have cited, that is called a self-citation. And there are references for every citation done in a text part in the article. There are enough references. The references are from recent publication, and the referencing is done in NLM style. Okay, according to journal guideline, you should do the referencing on NLM style, that is National Library of Medicine style. So they have done the referencing accordingly. However, you have read all the article, the whole part of the article. Now you should do the internal validity. What is an internal validity means? In internal validity, you have to critically evaluate how the methodology was conducted, what all things they have done, what all things they have not done. You should mention in the internal validity. If the methodology is done properly, it will have a good internal validity. If something is missing, some major portion or something they have not mentioned or they have not done for their research, then the validity, internal validity of the study decreases. So in this study, they have clearly talked about the ethical clearance. They have done the ethical clearance. They have done the Clinical Trial Registry of India registered, CTRI registered. Study personnel, they have talked about the Ayurvedic and modern medical doctors who are trained in GCP, good clinical practice. All are included in the study. Written and e-consent were taken. CFR compliant EDC system of electronic case record has been done. Study design has been mentioned. Investigator who enrolled the participant into the study was blinded. Dedicated COVID centers were identified and was kept confidential. Only COVID-19 cases with mild to moderate symptoms were included in the study. Inclusion criteria properly done. Severe to critical cases were excluded. How the sample size were derived also they have mentioned. Medicine manufacturer's detail also been mentioned. Primary secondary outcome is mentioned properly. Clinical status on WHO ordinal scale, 8-point WHO ordinal scale are used. For computer generate random sequence number, whenever do a random sampling, they have done a computer generated random sequence number. For randomization, they have done. Clinical records were mentioned for the part maintained for the patients. SpO2 and adverse effect were checked. WHO QL instrument for quality of life was assessed. Repeatedly, they have done RT-PCR. Results are presented properly. Study was financed by Dabur India Limited. Strength and limitation has been mentioned. Conflict of interest is there. Acknowledgement page there, and corresponding author details has also been mentioned. Now, when your internal validity is very good, your external validity also becomes very good. External validity means how can you generalize the results from the sample to the overall population. So as this COVID-19 disease has affected overall population in the world, this result of the study can be generalized as the use of fixed Ayurvedic medicine dose in addition to conventional treatment showed no adverse effects in Indian population and helps in far faster recovery, which can help many hospitals and care units to decrease the burden of disease and increase the quality of life of the patient. This is the external validity of the study. Thank you so much for critically evaluating or attending this. I'll just take a little more time and I'll show you how to critically evaluate using consort guidelines. This is very important. You should always focus on the consort guideline whenever you critically evaluate your articles. So coming to the consort guideline, this is a checklist of consort. I hope everybody can see this. So according to consort, they have few items, right from item 1A till around 25. They have the items. So whenever you conduct a journal club or whenever you critically evaluate a journal club in which there is a randomized control trial or randomized trial or a clinical trial, take a print of a consort checklist. If you are also planning to publish your randomized control trial, take a checklist, consort checklist, and see what all things has to be mentioned when you are reporting, okay, your study, your randomized control trial. So just have a look. Identification of the randomized trial. Yes, in the title, they have mentioned that it is a randomized trial. Abstract is structured. Background and explanation of the rationale is given in page number 2. Hypothesis is given in page number 3. Trial design in page number 2. Trial commencement, time, period, everything, reason, eligibility criteria, inclusion criteria has not been mentioned about the participants, but eligibility criteria of the participants is mentioned in 2.3, 2 to 3, page number 2 and 3. Setting location in page number 2. What intervention they have taken in page number 2 to 4. Outcome in page number 3. Trial outcome after the trial commenced with reason they have not done any changes. So they have not mentioned. No, it is not mentioned. Sample size derived, determined, mentioned in page number 3. Any interim analysis they have not done. Between the study, they have not done any analysis. So it is not mentioned. So it is no. Random allocation sequence they have done in figure 1. They have shown in figure 1. They have not mentioned whether they have done block size or blocking, but they have mentioned about computerized assisted random allocation number. So it is not mentioned. The blocking and block size is not mentioned. Random allocation sequence or sequentially numbered containers, they are mentioned in page number 3. Random allocation sequence in page number 2. Blinding investigator, only investigator is blinded, given in page number 3. If relevant, description and similarity of intervention, it is not applicable for this study. Primary and secondary outcome in statistical method not discussed. And they have not talked about subgroup analysis. So the one demerit limitation of this study is they have not talked about the statistical method. They have not mentioned about anything about statistics in the methodological section. Ideally, we should mention what statistics, what confidence interval, what test, statistical test, all those things, what software used for statistical analysis has to be mentioned in your article, which is not mentioned in this particular article. So according to consort guideline, it is not discussed in this study. Coming to results, they have mentioned about the primary outcome in figure 1. Loss, no loss to follow up. There was in page number 4, they have mentioned. Recruitment and follow up in page number 2. Why the trial ended or stopped, there it's not applicable for this study, so they have not mentioned. Demographic and clinical characteristics, they are mentioned in page number 4 to 5 in the text. Okay. Number of participants assigned for each group, they are mentioned. Yes, 35 participants in FAR and 33 participants in SOC. In outcome and estimation, table number 3 to 12, everything they are mentioned about outcomes, the results, which is clearly mentioned. Okay. Effect size, they have not, it's not applicable for this study because they didn't want it to go for effect size. They just were looking for the mean, standard deviation, and the proportion. There is no talk about odds ratio or relative risk or weighted mean difference. These are effect size, which is not mentioned here, and it is not applicable. They didn't want it to go with effect size, so it's not applicable. Any subgroup analysis, they have not mentioned. Whether they are divided again into subgroups, they have not mentioned about it. Any unintended or harm effect, there was no major adverse effect observed. They are coming to the discussion. They are number 20. They are talking about trial limitations. Yes, they are mentioned in page number 11. About external validity, that is generalizability, they have mentioned in page number 11. Are the interpretation consistent with results? Yes, page number 9 to 11, they have mentioned about it. Registration number and number of trial, name of the trial registry also mentioned in page number 2. The full trial protocol also can be assessed. Yes, it can be assessed. They are mentioned in the clinical trial protocol, they can be assessed. And funding and other role of funders have been mentioned in page number 11. So this is how you should critically evaluate using a consort checklist. Am I clear enough? If you have any doubt, you can put up in the chat box, or you can unmute yourself and talk to me.
Yeah, thank you so much, Vineet sir, for that lovely presentation. And I could see that there was a lot of effort being made on how to read it. I mean, you have highlighted the areas where you have gone through the checklist, and then you put it in the checklist with the page number and everything. So it was really nice method to start with. And those who are beginners at this point and they wish to publish their articles in some journals, they can start opting this method. This very simple and feasible method. You can have checklist ready in your hand and just go on reading the articles. So, and you also beautifully mentioned the concept of validity. So, validity is something which we generally never go for assessment, but it is very important in terms of how it can be replicable on a larger scale and how it can be a trend setter in research. Ultimately, we want to find out the solution. And here, when Ayurvedic treatment is being considered as add-on treatment, most of the time we struggle into superiority trial and that kind of approach. Yes. But here we are having this add-on kind of approach where we are not denying anybody's presence, but at the same time we are also putting up our mark that this also helps in a better way, and together, because they shared both the readings, that's individually and together. So together it gives added advantage for both the factors. So it was lovely presentation, sir, and I hope everybody is getting benefited out of it. So
and thank you so much for inviting, ma'am. And it was wonderful. I guess this is my third or the fourth time when I'm taking a journal club for apart from dentistry.
Yeah.
And I might be wrong in pronunciation of few Ayurvedic terms, probably. So don't mind that, because I'm not used to talk on those terms. And one thing I'd like to tell all the reviewers, all the viewers here, make a habit of reading an article. At least one article you should read every single day. At least one article. I still have the article. I read one article every single day. I carry article in my bag. Any article, my postgraduate students article or my undergraduate students article or my faculty, I have a habit of reading article. I don't go for books. I personally don't, not a big believer of books, because books give basic knowledge. Definitely books give basic knowledge, but it's not updated every single day. Article is something which is updated every single day. There is a research going on every single day and people are updating the articles. So have a habit of reading articles. Read article from top to bottom, each and every word, and keep conducting journal clubs, ma'am, because this is a place where, it was more good if you do physical, because there was a more interaction and properly we can study the study design and all those things very well. Thank you so much, ma'am. Thank you for inviting me, and thank you for making me a part of this wonderful concept of journal club in Ayurveda research. And it is an honor and pleasure to dedicate a time for these journal club for Ayurveda research. And it is a pleasure to be a part of it. Thank you so much, ma'am.
Thank you so much, sir. And I tell you that this meeting is being recorded and it will be put on our Facebook page of Council for Ayurveda Research USA. and also Council for Ayurveda Research, Journal Club, and other activities where we have two separate pages, and we put up these links there so that even if some most of them are registered, but what happens nowadays, there is a constant reminder, and sometimes they might miss it, but they again visit back on the Facebook page. So I would like to mention that if somebody is having queries, they can write to us on our email address, ayurvedaresearchusa@gmail.com, and they can follow us on our Facebook page. And Dr. Vinay is always there to help us out whenever you are stuck on the statistical part or even writing or reading out particular element from the journal article. So thank you so much, sir, for being there. And like you have explained all the things, and I hope there are no further questions. But when this video will be seen by most of the participants on the Facebook, they can put it in the chat box there also, and we will get back to them with the clarification.
Yes, ma'am, definitely. Anytime.
Thank you so much, sir, for being
Thank
here.
You, ma'am.
Pleasure having you. Thank you.
Thank you very much, ma'am. Thank you, guys. Thank you for attending. Thank you very much.